Acamprosate. Acamprosate is used along with counseling and social support to help people who have stopped drinking large amount of alcoholism, to avoid drinking alcohol again. Drinking alcohol for a long time change the way the brain works. Acamprosate works by helping the brains of people who have drunk large amount of alcohol to work normally again. Acamprosate does not prevent the withdrawal symptoms that people may experience when they stop drinking alcohol. Acamprosate has not been shown to work in people who have not stopped drinking alcohol or in people who drink large amount of alcohol and also overuse or abuse the substance such as street drug or prescription medication. How should this medication be used? A composite comes as a delayed release. Release the medication in the intestine. Tablet to take by mouth. It is usually taken with or without food 3 times a day. To help you remember to take a composite, take it around the same times every day. Taking a composite with breakfast, lunch and dinner may help you to remember all 3 doses. Follow the directions on your prescription label carefully and ask your doctor or pharmacist to explain any part to you to do not understand. Take a composite exactly as directed. Do not take more or less of it or take it more often than prescribed by your doctor. Swallow the tablet whole. Do not spill, chew or crush them. A composite helps to prevent you from drinking alcohol only as long as you are taking it. Continue it. Take a composite even if you do not think you are likely to start drinking alcohol again. Do not stop taking a composite without talking to your doctor. If you drink alcohol while you are taking a composite, continue to take the medication and call your doctor. A composite will not cause you to have an unpleasant reaction if you drink alcohol during treatment. Other uses for this medication. This medication may be prescribed for other users. Ask your doctor or pharmacist for more information. What special precautions should I follow before taking a composite? Tell your doctor and pharmacist if you are allergic to a composite, any other medicines, sulfites, or any of the ingredients in a composite tablet. Ask your pharmacist for a list of the ingredients. Tell your doctor and pharmacist what prescription and non-prescription medication, vitamin, nutrition, supplement, and herbal product you are taking. Be sure to mention antidepressant. Your doctor may need to change the doses of your medication or monitor you carefully for side effects. Tell your doctor if you are thinking of or have ever thought of harming or killing yourself. If you have ever tried to do so, or if you have ever used street drug or have overused prescription medication. Also tell your doctor if you have or have ever had depression or kidney disease. Tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. If you become pregnant, will take a composite. Call your doctor. If you are having surgery, including dental surgery, tell the doctor or dentist that you are taking a composite. You should know that a composite may affect your thinking, ability to make decisions, and coordination. Do not drive a car or operate machinery until you know how this medication affect you. You should know that people who drink large amount of alcohol often become depressed and sometimes try to harm or kill themselves. Taking a composite does not decrease any and may increase the risk that you will try to harm yourself. You may develop depression while you are taking a composite even if you do not go back to drinking. You or your family should call the doctor right away if you experience symptoms of depression such as feeling of sadness, anxiousness, hopelessness, guilt, worthlessness or helplessness, loss of interest or pleasure in activities you once enjoyed, lack of energy, difficulty concentrating, making decision, or remembering, irritability, sleeping problems, change in appetite or weight, restlessness, or thinking about harming or killing yourself or planning or trying to do so. Be sure that your family knows with symptoms may be serious so they can call the doctor right away if you are unable to seek treatment on your own. What especially dietary instructions should I follow? Unless your doctor tells you otherwise, continue your normal diet. What should I do if I forget a dose? Take the missed dose as soon as you remember it. However, if it is almost time for the next dose, skip the missed dose and continue your regular dosing schedule. Do not take a double dose to make up for a missed one. What side effect can this medication cause? A composite may cause side effect. Tell your doctor if any of these symptoms are severe or do not go away. Diarrhea, gas, upset stomach, loss of appetite, dry mouth, dizziness, itching, weakness, nausea, anxiety, difficulty falling asleep or stapling asleep, sweating. Some side effects can be serious. The following symptoms are uncommon, but if you experience either of them or those mentioned in the special precaution section, call your doctor immediately. Burning, tingling, or numbness in the hand, feet, arms, or legs. Rash. The composite may cause other side effects. Call your doctor if you have any unusual problem while taking this medication. If you experience a serious side effect, you or your doctor may send a report to the Food and Drug Administration. MedDodge Adverse Event Reporting Program online or by phone. What should I know about storage and disposal of this medication? Keep this medication in the container it came in, tightly closed and out of reach of children. Store it at room temperature and away from excess heat and moisture, not in the bathroom. Unneeded medication should be disposed of in special ways to ensure that pets, children, and other people cannot consume them. However, you should not flush this medication down the toilet. Instead, the best way to dispose of your medication is through the medicine take back program. Talk to a pharmacist or contact your local garbage recycling department to learn about take back program in your community. See the FDA Safe Disposal of Medicine website for more information if you do not have access to take back program. It is important to keep all medicine out of sight and reach of children as many containers, such as weekly pill windows and those for eye drops, cream, patches, and inhalers, are not child resistant and young children can open them easily. To protect young children from poisoning, always lock safety caps and immediately place the medication in the safe location, one that is up and away and out of their sight and reach. In case of emergency, overdose. In case of overdose, call the poison control helpline. Information is also available online. If the victim has colpast seizure, has trouble breathing, or can't be awakeness, immediately call emergency service at 911. Symptoms of overdose may include diarrhea. If you take too much Acamprosate regularly for a long time, you may experience certain symptoms. Can your doctor if you have experienced any of these symptoms? Loss of appetite, upset stomach, constipation, extreme tiredness, muscle weakness, restlessness, confusing. What other information should I know? What other information should I know? Keep all appointment with your doctor and consular or support group. Do not let anyone else take your medication. Ask your pharmacist any question you have about refilling your prescription. It is important for you to keep a written list of all of the prescription and non-prescription medicine you are talking as well as any products such as vitamins, minerals or other dietary supplement. You should bring this list with you each time you visit a doctor or if you are admitted to a hospital. It is also important information to carry with you in case the emergencies. Brand name Campral